for Dartmouth North.
Mr. Speaker, my question is for the Minister of Health and Wellness. Last week, the Legislature's Health Committee heard from Martha Painter, a registered nurse in abortion and reproductive health care, and Dr. Melissa Brooks, an OBGYN at the IWK, about the need to provide free birth control to Nova Scotians. They pointed out that while medical and pharmaceutical abortion is free, birth control is not. This means that the government will cover the cost of a $2,000 abortion, but not the $400 cost for an IUD or $30 monthly cost for oral contraceptives. Family pharmacare does not help most people who can't afford birth control. So, Mr. Speaker, does the minister think that it makes economic sense to offer free contraceptives?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. Thank the member for the question. So currently we are undergoing the formulary review, I think, as the member knows, and we are looking at a number of different options. I did watch the committee last week and was grateful to have the feedback from folks. So it is part of the review that we're doing, looking at that. We have a number of competing requests and a number of, people who have things that they want covered and finite resources. So what I will say is that we currently are under review, and we will take the information that we heard last week under consideration.
The member for Dartmouth North.
Thank you, Mr. Speaker, and I thank the minister for that answer. And just in case she needs more information, I'm going to table that it's not just Dr. Painter and Dr. Brooks who think this is a good idea. The Canadian Pediatric Society, Oxfam Canada, Actions Canada for Sexual Health and Rights, the Canadian Association of Midwives, the National Aboriginal Council of Midwives, the Canadian Medical Association, the Society of Obstetricians and Gynecologists of Canada, Dr. Alison Holland, a pediatric doctor at the IWK, the medical director at the Halifax Sexual Health Centre, and 33 OBGYNs, family practice doctors and nurse practitioners from across Nova Scotia have all called on the government to create a free, universal prescription contraception program. Say that 5 times fast. Mr. Speaker, will the minister agree that will the minister agree with these experts and doctors that free contraceptives are an essential part of public health care?
The Minister of Health and Wellness.
Thank you, Mr. Speaker, and thank the member for the question. So certainly since I've taken on the role of Minister of Health, I've met with a large number of stakeholder groups, all of which have very valid concerns and things that they would like us to cover as government. We are undertaking a formulary review. We are looking at the family pharmacare program, recognizing that we have finite resources. So we will, again, take some of the information that we heard, and I'm happy to have a look at the information that's tabled, but at this time I cannot make any commitments.